A child developed a mild fever and faint rest. Nothing dramatic, no severe symptom. The parents didn't even bring the child to see a doctor. The child went to school as usual and unknowingly passed the virus to the teacher, a pregnant woman in her first trimester. The teacher only developed mild symptoms too. But because she had been trying to conceive for many years and did not want to risk her pregnancy, she visited her doctor. Her doctor informed her about outbreak in their area and that the consequences for her unborn baby could be lifelong and irreversible. True enough, the child was born deaf. The virus is rubella. Hi Healthy Buddies, I'm Dr. Tirta Wijaya. Welcome to my channel where we will discuss about various health topics. And today we will discuss about rubella infection. Although many people think of it as a mild childhood illness, rubella has one of the most devastating complications in infectious disease when it occurs during pregnancy. Unlike many infections that make you feel seriously ill, rubella often appears so mild that people don't even realize they have it. In fact, more than half of infections can have very few symptoms. Yet, during pregnancy, this virus can cross the placenta and infect the developing baby, leading to a devastating condition called Congenital Rubella Syndrome, causing deafness, heart defects, blindness, and lifelong disability. What makes this even more concerning today is that diseases we once thought were under control are starting to reappear in outbreaks. One major reason is declining vaccination rates in some communities. So in this video, we are going to break down everything you need to know about rubella in a clear and practical way. We will cover what exactly rubella is and how it spreads, the serious risk during pregnancy, and how doctors diagnose and manage it. And most importantly, how vaccination protects individuals, family, the unborn children, and entire communities. This video is part of a series on measles, mumps, and rubella, 3 viral infections that are preventable with MMR vaccine, yet are making a comeback in some parts of the world. Let's start with a simple question. What exactly is rubella? And why has it been such an important target for vaccination programs worldwide? Rubella is often much milder than measles, which is why many people underestimate it. If it is not teratogenic, rubella would be of little clinical importance. Teratogen comes from Greek words terato, meaning monster, and gen, meaning producing. So teratogenic means having the ability to cause the formation in developing embryo. Rubella is transmitted by aerosolized respiratory secretions via coughing, sneezing, or respiratory droplets. Patients are contagious 4 to 5 days before the rash appears until 5 days after the rash disappears. Because people can spread rubella even before they realize that they are sick, outbreaks are difficult to control, making prevention much more important. And the most effective prevention of rubella to date is vaccination. Fewer than 10 rubella cases were reported in the United States in 2003. And in 2004, it was declared as eliminated. But after the vaccination coverage rate dropped, in 2025, there were 2,283 reported cases in the US. And as of 5th of March this year, there were 1,281 confirmed cases. This is rubella outbreak. Clinical diagnosis is difficult in some cases because of its variable expression. In one study, Over 80% of infections were very mild, even asymptomatic. Young children may only have rash. Older patients often have non-specific mild fever, ocular pain, sore throat, and myalgia. Swollen lymph nodes behind ears and neck is characteristic. This often precedes the rash or may occur without rash. The pink rash starting on face, a slapped cheek appearance or pruritus may occur. Sandpapery or maculopapular raised flat spot variants may occur too. The rash spreads quickly to the trunk and extremities after it fades from the face. It is gone by the 4th day. Because rubella virus can cross the placenta and infect the baby in the womb, more than 80% of women infected in the first 4 months of pregnancies are delivered of affected infants. Congenital disease occurs less than 5% of women infected later in pregnancy. This is what we call the Congenital Rubella Syndrome. The main manifestations are growth retardation. Between 50% and 80% of infants are small at birth and remain so. Then cardiac or heart anomalies like pulmonary artery stenosis, patent ductus arteriosus, ventricular septal defects, and others. And ocular or eye anomalies like cataract, microphthalmia, glaucoma, retinitis. Then deafness, cerebral or brain disorders like chronic encephalitis and mental retardation. Hematologic or blood disorders, immune disorders, hepatitis, diabetes, and many others. Encephalitis may happen in 1 out of 6,000 cases. This is a non-specific para-infectious encephalitis associated with a low mortality rate. A syndrome resembling subacute panencephalitis has also been described in congenital rubella. Arthralgia and arthritis occurs more often in adult women, typically affecting joints of the fingers, knees, and wrist. Frank arthritis occurs in a small percentage of patients. Virus may be isolated from throat or urine from 1 week before to 2 weeks after onset of rash. But children with congenital infection are infectious for months. Doctors can diagnose using blood tests for rubella immunoglobulin M or immunoglobulin G too. Explanation about immunoglobulin M and G can be found in my other video about immunity. Because the decision to terminate a pregnancy is usually based on serologic results, testing must be done very carefully. There is no specific treatment for rubella. Symptomatic therapy usually is sufficient. Arthritis may improve with anti-inflammatory agents. The prognosis is excellent in children and adults, but poor in congenitally infected infants, in whom most defects are irreversible or progressive. As I mentioned in the beginning of this video, the most effective prevention of rubella up to date is vaccination. When the vaccination rate fell, the rubella cases returned. It is a live attenuated vaccine commonly given together with vaccines against measles and mumps. We will cover these two in my next videos. 2 doses recommended, and the immunity can last for at least 15 years. All susceptible adults in institutional settings like daycare centers, kindergartens, schools, colleges, hospitals, healthcare personnel, etc. should be immunized. Susceptible pubertal girls and post-pubertal women should also be immunized unless they are pregnant. Whenever rubella vaccination is offered to a woman of childbearing age, pregnancy should be ruled out and the woman advised to prevent conception for 3 months after the vaccination. If a woman becomes pregnant within 3 weeks of vaccination, she should be informed about the risk to her fetus. The risk of getting congenital rubella syndrome from vaccination is from 0 to 1.6%. It is much lower than the risk from wild infection during the first trimester of pregnancy that reaches up to 85%. In children, adverse effects from rubella vaccinations are uncommon. About 10% of children may develop rash, fever, or lymphadenopathy a week after vaccination. Rash can also occur alone or as a mild rubella illness in about 3% of adults. Arthralgia and arthritis occur in less than 2% of 6 to 16 years old children after vaccination, as opposed to 10 to 25% of adult vaccines. Chronic arthritis to vaccination occur more often in women aged 45 or older, about a week after vaccination and lasting up to 1 year. Very rare complications include peripheral neuritis and neuropathy, transverse myelitis, and diffuse myelitis. That is my sharing today about rubella, that is often described as mild illness. But when it infects a developing baby, the consequences can last a lifetime. The good news is that this is one of the most preventable viral diseases we know. In the next video of this series, we will take a closer look at another member of the MMR group, measles. I hope you found this video helpful and can be a blessing. If you like this kind of health information, kindly like this video and subscribe for more health information from me. If you have any health-related questions or topics you'd like me to cover in my future videos, just type them in the comment section below. But please do not consult your health issue here, as it must be done personally with your doctor. This is my disclaimer. Thank you for watching. Stay healthy and happy.